Hi everyone, welcome back to Health Made Simple with Dr. Anim. I'm Dr. Anim. Today we're talking about that fire in the belly, gastritis, and peptic ulcers. Whether you're in Lagos, Accra, London, or New York, these stomach issues affect millions. Have you ever felt a sharp burning in your upper stomach after a spicy bowl of jollof or during a stressful week at work? Many people brush it off as just gas, but it could be more. Today we'll break down the causes, the food myths, and how to protect your stomach lining. Stick around for the next few minutes, and you'll know exactly how to tell them apart. Let's get into it. First, let's clear up the confusion. Gastritis is simply inflammation. Imagine your stomach lining, the inner wallpaper, getting red, raw, and irritated. It's like a sunburn inside your stomach. It makes you feel bloated, nauseous, or like you have a dull ache. A peptic ulcer is more advanced. It is an actual hole or an open sore in that lining. If gastritis is a sunburn, an ulcer is a deep blister. These usually happen in the stomach or the first part of your small intestine called the duodenum. The key difference? Gastritis is often the warning sign. If you don't treat the inflammation, it can erode further and become a painful ulcer. Globally, and especially in regions with high H. pylori rates like West Africa, these are some of the most common reasons people visit the clinic. So, what causes the damage? The number one culprit is a germ called H. pylori bacteria. It's a hardy bug that weakens your stomach's protective mucus coating. In West Africa, studies show a high prevalence of pylori, often spread through shared food, untreated water, or close contact. Next is the NSAID trap. Many of us reach for pain relievers for every headache. These are non-steroidal anti-inflammatory drugs. Common examples include Ibuprofen, Aspirin, Diclofenac, and Naproxen. If you take these frequently on an empty stomach, they strip away your stomach's natural protection. And let's settle the food myth: spicy peppers and suya do not cause ulcers. However, if you already have inflammation, the acid and spice act like salt in a wound. Finally, alcohol and smoking increase acid production and slow down healing. If you ignore that burning sensation, things can get dangerous. An ulcer can bleed if it eats into a blood vessel. If you ever notice black, tarry stools, or if you vomit something that looks like coffee grounds, that is a medical emergency. Go to the hospital immediately. Another serious issue is perforation. This is a hole that goes all the way through the stomach wall, causing sudden, agonizing pain that requires immediate surgery. Even chronic slow bleeding can lead to anemia, leaving you feeling weak, tired, and pale. The good news? We can fix this. We usually test for a pylori through a simple breath test, stool test, or an endoscopy, which is a small camera down the throat. If it's bacteria, we use what is called triple therapy, a combination of 2 antibiotics, and a medicine like omeprazole that lowers acid so the sore can heal. We also need lifestyle adjustments. Swap the ibuprofen for paracetamol or acetaminophen for general pain, as it's much gentler on the stomach. And try eating smaller, more frequent meals to keep the stomach acid occupied. Prevention is always better than cure. Practice good hygiene. Wash your hands thoroughly before eating and ensure your drinking water is treated or boiled. Be NSAID smart. Never take ibuprofen or diclofenac on an empty stomach. Always have a little food first. Manage your stress. High stress increases stomach acid, so whether it's prayer, meditation, or just a walk, find what works for you. And most importantly, listen to your body. If you've been taking antacids for more than 2 weeks, stop self-doctoring and see a professional. Knowledge is the best medicine. If this helped you understand your stomach a bit better, give this video a thumbs up. Comment below, have you ever had a bad reaction to painkillers? I'd love to hear your story. Don't forget to subscribe to Health Made Simple. Stay healthy, and I'll see you in the next one.